Another study, published in Intensive Care Medicine in 2006 by Balik et al., looked at ultrasound estimation of volume of pleural fluid in mechanically ventilated patients. The goal of the study was to develop a method to estimate the volume of pleural fluid with the purpose of achieving safe and uncomplicated drainage. In that study, patients were assessed in the supine position with a mild trunk elevation at 15 degrees, and a transverse ultrasound view of the chest was obtained in the posterior axillary line. The maximal interpleural distance was measured in the exact same way than what was described in the previous article. The success rate of obtaining fluid under ultrasound guidance was 100%, with an incidence of pneumothorax or bleeding of 0%. Based on their study findings, they were able to develop a simple formula to estimate the amount of pleural fluid volume. The estimated volume in milliliter equals 20 times the maximal interpleural distance in millimeter measured at end expiration. That measurement is abbreviated as SEP or SEP in the formula to describe the distance separating the two pleural layers. A significant positive correlation was found between the volume of pleural fluid in milliliter and the maximum separation of pleural layers in millimeter. In this study, small pleural collection with pleural separation smaller than 10 mm were excluded. In their discussion, they mentioned that ultrasound evaluation of pleural effusion is important in two ways. First, it helps quantify the pleural fluid using the simplified formula V equal 20 times SEP, and hence helps in deciding whether or not thoracentesis should be performed in high-risk patients. Second, it helps provide visual guidance for thoracentesis. Again, note that the complication rate in this study was 0%. They also mentioned in their conclusion that ultrasound performed at the bedside saved time, limited radiation, and brought further savings on X-ray material.